I was often out on my own as a young geologist, and fortunately I didn't have to use the service, but I was well aware of the wonderful service the Royal Flying Doctor provided. In 2010 we became a principal sponsor of the Queensland division of the Royal Flying Doctor Service.
Chris Wallen had an idea around mobile dental care for people living in rural and remote communities from things he'd actually seen on the ground. What QCoal Foundation have done is really changed the shape of dental care in rural Queensland and Australia-wide. It's been an incredible gift they've given.
I was aware of a need to provide dental health services to rural and remote Queensland. The people there are a long way from the services they need, and I noted that was not only affecting their dental health but also their entire health. It's one thing to have an idea. It was very smart to team up with the Royal Flying Doctor Service if you're going to be delivering health outcomes in rural and remote areas, because they're the professionals.
QCoal funded the program for us to allow us to really trial the program, so it allowed us to set up a service, show an increase in health outcomes and a sustainable business model, and then we were able to go to the federal government and ask for funding.
It was spectacularly successful, and the feedback from people and communities has been outstanding. And we ran it for 4 years and saw over 8,000 patients in that time, and really made a difference in those communities. You could never predict that we would have such a strong case that the federal government would see the need to fund it and also to roll it out nationally. So I'm especially proud that it went further than what we originally envisaged.
The great value that it's given us, this partnership, is we've proved the concept of mobile service delivery. So now we can take it even further. So I think it will completely change the shape of how we deliver care to these rural and remote communities. That might be in relation to screening, women's health, chronic disease management, taking specialist services to the bush. So there's really a whole range of ways we can use that proved model.
There's always more to be done. So the challenge now is to continue the partnership and deliver services in other areas to make sure people in rural or remote Queensland have the same health outcomes as in the capital city.
I think what's ultimately underpinned this partnership and why it's been successful is we've just got a common vision to improve the health outcomes of people living in rural and remote Queensland. And I think John Flynn was an innovator. I think Chris Wallen is an innovator. The partnership's been essential in improving the health outcomes and dental care to people living in rural and remote Australia. I'm not quite sure how it would have happened if it wasn't for the wonderful support of QCoal and Chris Wallen's vision.